Right, Chelsey and I are here at the Chestnut Tree Foot Clinic and Orthotics, and I don't know a lot about foot care or orthotics, to be honest. Tell me a little bit about the clinic here.
So the Chestnut Tree has been here for about 25 years. I took over the practice in 2017.
Okay.
We originally were on the corner of 2 King Street East, just 2 doors up, and we've recently moved to our new office here on Lake Ave. So it's 9 Lake Ave South.
Okay, now you were telling me a little bit off camera, podiatry has a different term in Ontario than it does elsewhere.
So in Ontario, we are chiropodists.
I've never heard that word before in my life.
Chiropody is the specialty of foot everything. So basically we do corns, calluses, warts, fungus, ingrown toenails, all the fun stuff, yes. But our feet are so important, and we need them to get from point A to point B. So it's really important to take care of our feet for sure.
Do you find a lot of people neglect their feet?
100%. So we need our feet to walk and work and function. And it's one of those things that we typically don't pay attention to.
Right. Okay, well, we're going to take the viewers through some interesting things today. We're going to talk about diabetes and how your feet can be impacted. We're going to talk about ingrown toenails. I've had one. They're incredibly painful. We're going to focus on that. So don't go anywhere. Lots more coming up on Morning Live. Chelsey is working hard. We're here at Chestnut Tree, and we're talking about patients that have diabetes and how that can impact their feet. There are a couple of things.
So Sandy here is coming in for her routine diabetic foot assessment today. So one of the things that we look at is taking care of foot care for these type of patients. So one of the biggest things with diabetes is how it affects the feet. 11 million Canadians live with diabetes or pre-diabetic. And Sandy here comes in every 6 weeks and has routine foot care done just to make sure everything's looking good and we're avoiding any sort of infections or any sort of problems that may arise.
Okay, so what are one of the things that someone who has diabetes would be concerned of with their feet? There's numbness and there's that type of feeling that gets lost, correct?
Correct. So in diabetes, it is high sugar levels within the blood. So one of the things that happens is those sugar levels have to go somewhere. So they will accumulate on the nerves. And that can cause numbness, tingling, burning, achy sensations within the feet.
Okay.
And that then in turn is people can't feel the bottoms of their feet. So they often will continue walking even if they have a cut, scrape, bump, or bruise, which can cause an open wound.
Okay.
In turn, an open wound, you can get an infection very easily and turn into potentially an amputation. And that's what we're here for, is to make sure that we keep her healthy and happy and walking from point A to point B.
Okay, so the basics needs 6 to 8 weeks, come in, check up, toes.
You got it. So if you're diabetic and you don't have a chiropodist on your healthcare team, it's very important to reach out.
Okay, good to know. How does it feel, Sandy? Are you comfortable?
Oh, I'm very comfortable.
Yeah.
And they always feel so good when they're done.
For sure. Well, thanks, Sandy, for coming in and letting us examine your feet. Coming up, we're going to be talking about ingrown toenails. This is going to be a good one. Julian has joined us now, and Julian, unfortunately, suffered from an ingrown toenail. What are those?
Ingrown toenails are an inflammation of the skin around the nail. So Julian is a big hockey player and is in tight-fitting footwear. So one of the things that happened was this nail got all infected.
Okay.
Other reasons ingrown toenails can happen are from poor fitting footwear, like Julian, cutting the nail down the edge.
So not cutting them properly.
Not cutting them properly. One of the biggest things is it's hereditary. So some people just get them. Their nail grows curved. And the biggest thing, there is a solution.
Okay, what kind of solutions do we have that don't involve too much pain?
Yeah, so There are two options. One is conservative care. That's having it taken care of and managed by a chiropodist on a regular basis, normally every 4 to 6 weeks. Julian here is young and healthy, so that really wasn't something that he wanted to do, come visit me every 6 weeks. So we looked at the permanent solution. So Julian's here 1 month after having an ingrown toenail surgery done.
Okay, wow, it looks really good. From this angle, you can't even tell that there was anything wrong to begin with.
Yeah. So one of the things that we do with surgery is it's a very painless procedure, right?
Yeah.
It wasn't too bad. How old are you?
12.
12. So if Julian can do it, anyone can do it.
I think that's a really good point. I
Yeah.
mean, ingrown toenails are not something that just elderly or middle-aged people get. Kids get them too, and if it's relatively painless and relatively, non-invasive.
Yeah. So it's just 2 small needles. That was the worst of it. Wasn't too bad, eh? No. And then we freeze the area, remove that side of the nail where it grows in, and we use a chemical called phenol that kills it off. So 95% of the time, never have a nail grow back on that side.
All right, good to know. Thanks, Chelsey. Thanks, Julian. We've got much more coming up. Chelsey is having me walk to check out my balance and maybe check to see if I need to be fit for orthotics.
Perfect. Awesome. So orthotics are insoles that go inside the foot, as
Okay.
you can see here. They help with the misalignment of the foot, and it helps to support bringing the floor up to the foot. These can go in all different types of footwear. So we'll have,
You want me to get on here?
we'll have Emily actually hop up into the chair. So one of the things that we do is we do a biomechanical assessment, a gait analysis. So we watch her walk and see how the foot hits the floor. And now what we're gonna do is cast her. So this is plaster casting.
Okay.
And basically it's gonna be like a warm sock going on the foot. And this is gonna make a 3-dimensional image of the foot that will then be sent out to a lab to be made. So it does get a little bit messy here, but you'll feel it's a nice warm sock. It takes a couple minutes for it to harden.
Okay.
These will go out to the lab. It takes about 2 to 3 weeks to come back to us.
Now, what's different? I mean, obviously, this is just placed directly on your foot, so it is your foot molding, but you can buy orthotics, can't you, that just kind of slip into shoes? You wouldn't recommend those ones?
So there's different reasons why you would get orthotics, but these are custom made, so we can accommodate all different types of foot ailments. The over-the-counter ones, they can add some cushion to the foot, but they're not a true representation of the person's foot. So as you can see here, we're going to hold the foot in a neutral position where the heel and the calf muscle are in alignment. And this will take a couple minutes to harden. So,
All right. Okay, well, we're going to have to talk about the results some other time, but thank you so much, Chelsey. I really appreciate all the information that you've taught us today. And if you need to get some foot care taken care of, make sure you come to the Chestnut tree.